Physical therapy is primarily known for patients recovering from surgery or injury-related trauma to the musculoskeletal system. Occupational therapy, on the other hand, focuses on restoring independence to those who have been disabled by illness, accident, or aging. Physical therapy and occupational therapy are both in possession of their own exclusive benefits, but with a variety of differences between them, it's crucial that you know which one is right for your needs. And if you like it and want more videos to improve your health, don't forget to smash the subscribe button. What is a physical therapist? Physical therapists are crucial members in the rehabilitation process of patients within all age groups. Their main focus is the study of human movement and its relationship to health, prevention, and restoration. Their main goal is to restore maximum function for an individual through specific exercise routines, modalities, and therapeutic exercises. Oftentimes, physical therapy focuses on treating chronic injuries or conditions, as well as orthopedic diagnoses such as lower back pain, knee pain from arthritis, or shoulder pain after rotator cuff surgery. But they do not work solely with these types of ailments or diagnoses. What is an occupational therapist? Occupational therapists are often seen in pediatrics, geriatrics, and mental health. They use therapeutic activities to establish a customized plan for individuals with developmental disabilities and work with them to achieve daily tasks. They also provide encouragement and support, as well as assisting individuals in achieving their highest level of quality of life possible in the realm they live. Not only do they provide direct clinical care, but they provide resources and guidance to clients' families and teach them how to be supportive agents in their loved ones' recovery process. What are the differences? Physical therapy focuses on restoring function and movement of patients' bodies. Occupational therapists focus their efforts on restoring lifestyle, independence, skills, and educational development in individuals who have lost their quality of life due to a permanent injury or illness. Physical therapists generally treat orthopedic injuries, inpatient care, and chronic conditions through home exercise programs and rehabilitation at outpatient facilities. Occupational therapy focuses on clients with developmental disabilities, such as cerebral palsy or stroke. Their practices are entirely different from each other, but oftentimes they work very closely together to assist a patient with multiple disabilities without any assistance for the patient's family. The choice of a physical therapist or an occupational therapist can become very important for the surgical patient after their surgery. It's important to find the therapy that will best help you in your recovery process. For example, if you have knee surgery, a physical therapist would help you increase mobility, whereas an occupational therapist would focus on helping you with the home exercises needed after your knee surgery, as well as helping you with other daily activities. The difference between physical therapy and occupational therapy is very broad. There is room for overlap between the two professions, and because of this, many students aren't sure which one they are interested in pursuing as a career. Both professions have a lot to offer in terms of work environment and patient populations, but it's always important that patients know what to look for in each profession before deciding which career path they should take. Physical therapists can be seen in many different settings and can provide their patients with direct care in a physical therapy clinic or at an outpatient facility. Occupational therapists, on the other hand, are more often seen in a hospital or rehabilitation center, so they're less likely to treat orthopedic conditions. It's always a good idea to talk to the professionals at whichever facility you are considering, so that you know what each career path offers. In some cases, it's possible for occupational therapists to be seen in either setting, and some centers do not have any dedicated occupational therapy staff, so patients may be seeing both physical therapists and occupational therapists. A physical therapist and an occupational therapist will both spend their day working with patients in the early stages of rehabilitation or support. Their work involves helping patients build a strength or skill set for regaining their independence or reaching their goals. Occupational therapists help patients achieve their highest level of quality of life possible by teaching them how to be as independent as possible and assisting them with little tasks we take for granted, like taking a shower, dressing oneself, and cooking meals. Targeted interventions for patients with a physical disability can be performed by either an occupational therapist or a physical therapist. Many of these interventions are also performed in other areas of the healthcare field, such as geriatrics and pediatrics. These target interventions are sometimes referred to as functional activities because the goal is to help patients perform the functional tasks that were lost due to a permanent and severe injury or illness. Occupational therapists focus on developing therapeutic exercises to be used by patients in their daily lives throughout the rehabilitation process. Examples of therapeutic exercises include: functional activities are often performed using low-intensity exercise programs that involve repetitive motions, maneuvers, or movements. Occupational therapists also develop an activity program for a patient. In the early stages of rehabilitation, there is a heavy emphasis on functional activities being used by patients. They are intended to help patients achieve their greatest possible quality of life and independence by continually working on regaining as many functional activities throughout their rehabilitation process as possible. In addition to performance-based goals, physical therapists also use functional activities with their patients as means of encouraging rehabilitation and adapting exercises to help patients reach their goals faster. Physical therapists often assign patients to an exercise buddy or therapist buddy so that the patient is receiving treatments from two different therapists for increased safety and quality care. Occupational therapists use a variety of different approaches to recovery from disability and disability progression. Occupational therapists work with a multidisciplinary team of health professionals who evaluate the patient's needs, provide treatment programs and plans, keep in touch with the patient's progress, and more importantly, coordinate the patient's care throughout the process. I hope you enjoyed this video. You're going to heal faster now that you know about the benefits of physical therapy and occupational therapy. If you have any questions, feel free to leave a comment below. Also, don't forget to let us know if this worked for you and how it affected your body. Thanks for watching this video, and if you want more videos on how to boost your metabolism and lose more weight, make sure you subscribe so you don't miss out on future videos.